A lot of people who start on testosterone therapy, they have certain expectations. How do you, Dr. Rudy, manage those expectations so they are a bit realistic for the patients?
Yes, and you know, that's something that is a big part of my job and my coordinator, my coaches that work day to day with the patients. A lot of patients come in with the expectation that taking testosterone is going to turn them into a Greek god, sculpted abs, or superpower, super sex driven. So people come with their own expectations. So although testosterone has a lot of positive side effects, my role is to manage it, give them the right timeline, and know that everybody's different. Everybody's biochemistry and physiology is different, and everybody responds differently. So the way we usually do it, we do a follow-up consult and follow-up labs 8 weeks, 2 months after we start treatment. And what I tell my patients is the first 4 to 6 weeks, don't expect to get much results. Usually by week 6, week 4 to 8, you will see that your energy level starts getting better. Energy and tiredness is something that's kind of difficult because there are so many things that can cause that. I have guys who get great results with testosterone, but their energy level has improved, but not great, because there could be something else causing it. Sleep apnea, thyroid issues, bad diet, insulin resistance, autoimmune conditions like Hashimoto's, leaky gut. There are so many things, but I tell them the first thing you should get is that you will see that you have more energy. You have better recovery, especially if you exercise. That when you go to the gym the first 2 months, you will see an increase in the density of your muscle and you start getting stronger. When it comes to sexual gains, within the first 2 months, you should see something, increase in morning erections. What I see a lot is even more increase in libido. I've had guys who told me, I was at home, I wasn't even thinking about sex anymore. It's like at home, we were roommates at home. I'm like, no, we are human beings. We are sexual beings. Even having that desire, even having that little horniness that's here and that you have that rapport with your partner, that is something that is very important in a relationship. And again, because I talk to patients about this and I tell them, try to notice those subtle changes. Sometimes it's not a subtle change. Sometimes some guys, 3 weeks later, they call, they're like, oh my God, great results. I'm like, good. But some other guys, it's more subtle. So I teach my guys, look for the positive, focus on the positive. The ones that didn't realize it, the results you didn't get yet, don't focus on those. Even if you see that, you know what, instead of taking a nap in the afternoon, now I don't need to take a nap, or less time of a nap, you're like, this is getting better. And you build on positive. Stephen, I don't know with your interaction if you see that. I'm an eternal optimist, and I am a strong believer as if you are good yourself and you focus on the positive, good things will keep happening to you. Even when bad things happen to you, you find the silver lining. And by thinking like this, you'll keep attracting better things into your life. And to me, testosterone puts you into that mindset, into that positive mindset where you're ready to attract more. So this is what I tend to see the first 2 months. Then a lot of my patients will come, they're like, Doc, you know, I don't have the biceps I want yet. I don't have the abs I want yet. And I'm like, testosterone results and success means different things for different people. For example, me, I have to tell you, at 51 now, I'm at the best shape of my life. I work out a lot. That's something I enjoy doing. So, and I have good genetics also. So for me, getting a good body is something that comes pretty easily to me and that I like. So I focus myself on this. For some guys, results and success in testosterone replacement may mean that they can play ball with their kids now. They can keep up and just play outside with them, that they don't come home and take a nap and don't even interact with their family. All those to me are positive gains. And if you focus on those, you take those small gains and you keep building on them, this is how 6 months, a year later, that you have even better results. So with my coaches and I, what we really try to do is focus on the positive, pay attention to the positive, be in tune with yourself, focus on what's working, and expect bigger things to happen.
Yeah,